portion size is definitely going to change after bariatric surgery. The quantity of food that can be eaten at one period of time, as well as the spacing of fluids when drinks are taken, the types of foods that can be tolerated. It varies by individual, but there are definitely specific categories that are going to be more problematic than others for patients, particularly after gastric bypass. The relationship with food and food choices after lap band surgery is also dramatically altered, but not to the extent that it might be with gastric bypass. What is of importance is fluid intake or calorie-containing fluids with the lap band surgery. For example, if someone is consuming a liquid like a milkshake, it can very easily slide through the constricted space and allow for greater calorie consumption during the day, which is going to hinder weight loss. In my experience, you can almost determine who the cheater is going to turn out being even before surgery happens. For example, a patient that says they're pursuing surgery so they can avoid specific eating behaviors such as sweets. If sweets are a trigger food, someone might say surgery is going to help me avoid these foods because of the potential for feeling nauseous or having dumping syndrome occur. But those people, if they truly crave these foods, what tends to happen is they find a way to make it possible to consume them over time. Everyone has different tolerances to different food groups. So the person who is determined to make those foods fit in finds a way to make them fit in. Liquid calories are another big area where if that was a cheating type food prior to surgery, it's definitely going to hinder weight loss after, things like ice cream or milkshakes. With regard to cheating, if an individual is not used to eating structured meals and chooses just to have small, frequent meals throughout the day, then that is an individual who really needs behavior modification prior to surgery to help them break that habit, get used to structure, get used to meal routines, and eat on more of a regimented schedule to enhance the weight loss results that are seen. If someone is eating small, frequent meals, then that tends to also increase the daily caloric total, and that's going to affect weight loss results, eventually at least. For long-term maintenance, a patient really has to be dedicated to choosing the right foods and thinking about food as fuel for their body versus just the pleasure of the eating experience itself. If food is chosen based on fuel, they're going to be better energized to get throughout the day. It's going to be a better quality calorie, and it's going to be within a caloric range to optimize on weight loss success. The other key component, in addition to fueling the body with food, is physical activity. And the true key, once weight is not as much of a factor and someone, so they've lost some significant weight and mobility is improved, they need to really hone in and find an activity that they enjoy doing so that it continues, because physical activity is going to be required from here on out in order to maintain the weight loss.